Yeah, hello guys. How was our day? How are you guys out there? Well, it's another evening again, and it's good to have all our followers. Want to say we appreciate all you are doing. Always there to watch our video and our post, and I'm sure that you are learning so much from us. Like we always say, you cannot follow us and remain the same. Your life must get better. Your life must improve for good. Either your health is getting better or you're learning ways to get richer or make money. So you're not just following us in vain. Do where to follow us, do where to like, do where to comment, and do where to share our videos and our posts regularly. You may not be able to give somebody money, but you can share our video and somebody will benefit from it. So thank you once again. Uh, it's today, this is evening, on the 9th day of June 2026, and we have a little topic we would like to just give a little insight to, and it's talking about having a routine medical screening or routine checkup, as we call it. Now, what is routine medical screening or checkup? Uh, it's just a routine or scheduled or timed follow up with your healthcare personnel who will take a thorough history or will build on initial history he has, do basic physical examination, request laboratory investigations when necessary, and may give you prescription, that's treatments, when necessary also. So you can see that routine medical checkup is important. Now we look at who needs routine medical checkup. Everybody needs a routine medical checkup because there are a lot of benefits of routine medical checkup, which I'm going to list just few. I'll be going live to discuss this topic because I want it to be participatory. But I said, let me drop this video so that people will use it as basis for live presentation. So everyone needs a routine checkup. For children, yeah, a child that has underlying maybe congenital uh, illness or disease states need to be going for follow-up or scheduled follow-up with the pediatrician or pediatric surgeon, depending on the condition. Now, for a younger adults, anybody above 18 years, ideally should go for routine checkup. Once above 18, you're already an adult, and based on exposure and your activity, you should go for routine checkup. Then for those that are already diagnosed to have an underlying medical condition, of course, you should go for routine checkup, which depends on your doctor. It may be weekly, it may be monthly, it may be 2 weekly, it may be every 3 months, every quarter. So it all depends, but everybody needs checkup. Those that have underlying ailments need more frequent checkup than those that are stable. Now, for those that have no underlying illness, at least you should go for a routine checkup once every 6 months. Now, routine checkup is not just going to do lab tests, as people will always do. Some people will just go to the lab, say, test me this, test me that, check this test and all that, and they say they've gone for routine checkup. No, a routine checkup entails seeing a doctor who asks you some questions in form of history, examine you, do some clinical examination, request for some lab when necessary, and then may give you treatment. That is the parameter that make up a complete checkup. But you go into the lab just to do tests, you are cheating yourself. So we want to encourage everyone to please make sure you go for routine checkup at least once or twice every year if you're not having any ailments. For those that have underlying ailments, you should have a scheduled follow-up with your doctor. And it's always good to continue with a doctor that knows you very well and knows what he's doing. But if you feel not satisfied, you can politely ask your doctor for a second opinion. It's not bad. But if your doctor knows what he's doing and you are convinced and you are seeing some improvements, please, you should schedule with your doctor on how often you come for follow-up. Follow-up helps a lot. Now let's look at the benefits. One of the benefits of follow-up, for you that don't have any underlying condition, it helps in dictating any sudden change in your health states. That is what we call early diagnosis. When things start going wrong, if you are someone that goes for routine checkup, the doctor or the healthcare personnel dictates it early enough. And it's always better. Early diagnosis goes a long way to prevent complications and subsequent deaths. Some people say, I don't get sick, but you see them once sickness like this, they never return. It's because they don't go for routine checkup. No sickness suddenly happens unless for accidents. No sickness. There will be sign. Or unless for pandemics. Understand? But some of the illnesses show their signs. They show you symptoms before they progressively get worse. So if you're someone that's always going for routine checkup, you dictate it early enough. So that's one of the benefits of routine checkup. So everyone should do well to go for their routine checkup so that if ailment is coming, if ill health is coming, you detect it early enough. Now, for those that already have an underlying ailment, what does routine checkup do for you? It helps you to monitor the progress of this underlying condition. If it's progressing very fast, it shows either that treatment, there is what we call treatment failure. Maybe the medication is not working. So it will help you to be able to dictate, okay, I need to change medication, I need to change lifestyle, or you need to change what you are doing because it's not working. So that's another benefit of routine checkup. Then it will also help you, like we have said, to seek an alternative care. Maybe there is a misdiagnosis. So it will help you to do further investigation and then possibly have alternative care. You can see that routine checkup is very, very important. And everyone should go for routine checkup. So we are running this campaign requesting everybody to please go for routine checkup. Nobody is exempted, whether you're healthy or not. Of course, like I said before, nobody is completely healthy by WHO definition of health. So everybody needs it, be it a child, be it an adult, be it those that are sick or those that are well. So do well in your community. Let us spread this campaign, encourage people to go for a routine checkup. You that is a healthcare personnel, when you see your patients, please encourage them on the importance and benefits of routine checkup. Always remind them. Yeah, it's natural for people now want to come to hospital for checkup because money is involved. Nobody wants to spend money. One of my patients once asked me, but doctor, why will I do all this thing? What about if the result comes out negative? Of course, you should be happy. Will you wait until you have a big diagnosis? Do you want to always have a bad news? If you go watch one of our videos, we posted the news and how the diagnosis and how the relative reacts. One man once came to my clinic and he was afraid he has HIV. But when we did the test and the thing came out negative, he was so happy. We did hepatitis, he was so happy. So go for a routine checkup. Go with your family members. Routine checkup is cheaper. The money you spend is cheaper compared to when a big diagnosis is made. Thank you very much. Keep following us on our channel. Keep sharing our videos. Keep liking. And please, most importantly, we want participation. So comment, ask your questions. It will help us to go back to the drawing board and discuss topics that will bring to you. Thank you very much. You can also subscribe to our YouTube channel. You can go to our Instagram and on Facebook. Follow us. It's a campaign we are running. We want a healthier nation and a richer nation. Thank you very much. See you next time.